In this video, we are going to discuss about peak flow meter or PFM. Let me tell you that you will have plenty of time to demonstrate this skill within 15 minutes. PFM as a skill includes more of talking and health education unlike other skills. You must demonstrate PFM and patient must demonstrate back to you. You must health educate the patient about bronchial asthma and also about techniques for increasing vital capacity and about the medicines that are used for treatment of bronchial asthma. Like every procedure, while you are entering the scene or the patient room, you have to ensure the scene safety. Then you need to demonstrate the hand rub technique using 7 steps of hand hygiene. Next, you need to introduce yourself as an attending nurse. Then you need to identify the patient. You need to identify the patient using their name, date of birth and hospital number, and you need to cross-check the same with the document you will be having. Next, you will have to check for allergies. The patient will be having bronchial asthma and they will have allergy to something like dust or pollen. You also need to check the allergy band on the patient arm. Then you need to check the patient for any pain, and if they are complaining of any pain, you need to score that using the pain assessment tool. Next, you need to explain your purpose of visit, that is teaching the peak flow meter procedure. You should ask the patient that whether they have used PFM previously. If they are telling that they have used peak flow meter before, you should ask them the highest value they have got as PFM reading. Then you need to confirm with the patient that whether they have taken any bronchodilator. If they have taken any bronchodilator, you need to wait for another 30 minutes for taking the PFM read. You need to make sure that the patient is rested for past 20 minutes. Next, you need to provide privacy to the patient by letting the doors, windows and curtains closed. Then you need to position the patient sitting upright without flexing neck or standing. Then you need to do a hand rub and go for assembling the articles. Before assembling the articles, you need to perform a hand washing using 7 steps of hand hygiene, preferably at wash basin. Then you need to assemble the articles for the procedure. The articles that need to be assembled includes a clean tray, confirming with the examiner that the tray is cleaned with soap and water in past 24 hours, a peak flow meter which is clean and calibrated, a disposable mouthpiece, alcohol wipes and gloves. You need to bring the tray near the patient. Then you need to go and do a hand rub. Then you need to explain the procedure in detail. You need to explain that the patient need to take a deep breath and expel air quickly as fast as you can. Ensure zero at the gauge before using PFM. Keeping fingers away from sliding pointer, hold PFM horizontally. Ensure proper sealing of mouth and avoid tongue from blocking the airway. Don't allow the patient to spit air and also prevent flexion of neck while blowing air. Take 3 PFM readings, and if the value is more than 40 liters per minute apart the readings, take 2 more readings and record the highest reading. You will be having a chart that shows the normal values of peak expiratory flow. Different maximum values for peak expiratory flow in regard to the age and height of the patient will be given. You need to interpret and explain the patient regarding the reading of the peak flow meter in accordance with the chart given. You have to find the maximum value patient can attain according to their age and height. You need to health educate them later about things he can do to improve their lung capacity. So, first you need to demonstrate the procedure yourself, change the mouthpiece and allow the patient to demonstrate, and record the highest reading. Before concluding the procedure, you should ask the patient whether they have understood the use of PFM without any doubts. After recording the highest value of PFM, tell the patient that you will replace the article and come back. Do a hand rub, put on a gloves and clean peak flow meter with alcohol wipes for 30 seconds before replacing. Discard any used items to the clinical waste. Next, we are going to talk about the health education to be given in peak flow meter skill. Peak flow meter is used for measuring the rate at which patient can expel out air from his lungs after taking a deep breath. Peak flow meter also measures degree of blockage in the airway of patient. Peak flow meter readings also allows the clinician to know how well the patient is responding to the treatment regimen of bronchial asthma. Patient need to use and record PFM reading twice in a day before they are using bronchodilator or inhaler. If patient has already taken any bronchodilator, he do need to wait for another 30 minutes before recording the PFM value. PFM value can be taken in either sitting upright 90 degree or in standing position. They should take the PFM reading every time in the same position they have done before. Patient can improve their lung capacity by using deep breathing exercises and manuals like blowing of balloon and exercising. Patient should avoid the triggering factors such as dust, pollen, etc., which they are allergic to, in order to prevent the asthma attack. Patient can bring their diary of readings when they visit their physician next time. Moving on to the care of peak flow meter. Equipment need to be washed after every 30 use. Peak flow meter should be cleaned with wipes after every use. For washing the peak flow meter, you can use a bottle sterilizer and you can dry the equipment in open. Equipment need to be changed after 1 year of use. So that's about peak flow meter. Please don't forget to like and subscribe our YouTube channel for more videos on OSCE. The name of our YouTube channel is OSCE for NMC Part 2 Training Videos.